Sexually transmitted infections and diseases, STIs and STDs, are transmitted through vaginal, anal, or oral sexual contact. Many STIs display no symptoms at all. Left untreated, they can lead to fertility problems and an increased risk of cervical cancer. These risks make it even more important to practice safer sex. Symptoms of an STD for those with a vagina can include vaginal itching, rashes, unusual discharge, pain. And now let's enlighten our mind about the causes of STDs. Causes. STDs can be caused by different kinds of microorganisms, including viruses, bacteria, and parasites. Bacteria and viruses that grow in warm and moist places in the body can cause STD. They are passed from one person to another through sex. Infections can be spread from the penis, vagina, mouth and anus. These infections can be minor or they can be very painful, even life-threatening. How do sexually transmitted infections or diseases spread? They are spread through fluids in the body, most often shared during vaginal, oral or anal sex. Some STD pass from one person to another through infected blood. STD are not spread through casual contact. Shaking hands, sharing clothes, or sharing a toilet seat, for example, would not lead to STD. And during my research I only found 6 common STDs in females, but I am still uncertain about this research, and for me there are still many STDs exist that can affect females that I still didn't find on my research. And that includes chlamydia, gonorrhea, syphilis, genital herpes, human papilloma virus and genital warts, HIV and AIDS. So let's start with chlamydia first.
Chlamydia is a sexually transmissible infection, or STI, that is passed between partners during unprotected vaginal, anal, and oral sex. Many people with chlamydia do not have any symptoms, so they may not even know they have it. It is the most common bacterial STI worldwide, especially among people aged 15 to 29 years. Chlamydia can infect the cervix, throat, anus, eyes, and the urethra, which is a thin tube connected to the bladder through which urine passes. Without proper treatment, chlamydia can spread further through the body, infecting the uterus and the fallopian tubes. These are the tubes that connect the uterus to the ovaries. When the body detects an STI, the immune system tries to destroy the infection. There are often no symptoms during this immune response, but sometimes the area can become inflamed and sore. As the STI is killed and immune system cells die off, they sometimes form a discharge at the opening of the vagina. The inflammation that occurs in the cervix, uterus, or fallopian tubes is called pelvic inflammatory disease, or PID. PID can present as mild abdominal pain, which can be missed if women mistake it for period pain. It can also cause pain or bleeding during or after sex. PID can also cause scarring, which can block the fallopian tubes and may result in infertility, as sperm released during ejaculation cannot travel through the tubes to fertilise the egg. Damaged or scarred fallopian tubes can also impact on the process of moving a fertilised egg through the tube towards the uterus at the start of pregnancy. The egg may then attach itself to the fallopian tube, where it begins to grow. This is called an ectopic pregnancy and can be very dangerous. Chlamydia can also be passed from mother to baby during delivery, causing an infection in the newborn's eyes. Chlamydia and other STIs can be prevented by using condoms and water-based lubricant during sex, having regular sexual health checkups, and ensuring you or your health provider notify your sexual partners if you are diagnosed with an STI. Gonorrhea is a sexually transmissible infection, or STI, that is passed between partners during unprotected vaginal, anal, and oral sex. It can infect the cervix, rectum, throat, and even the eyes. It can also infect the urethra. This is the thin tube connected to the bladder through which urine passes. Without treatment, gonorrhea can spread into the uterus and the fallopian tubes, which are the tubes connecting the uterus to the ovaries. When the body detects an STI, the immune system tries to destroy the infection. There are often no symptoms during this immune response, but sometimes the area can become inflamed and sore. As the STI is killed and immune system cells die off, they sometimes form a discharge at the opening of the vagina. The inflammation that occurs in the cervix, uterus, or fallopian tubes is called pelvic inflammatory disease, or PID. PID can present as mild abdominal pain, which can be missed if women mistake it for period pain. It can also cause pain or bleeding during or after sex. PID can also cause scarring, which can block the fallopian tubes and may result in infertility, as sperm released during ejaculation cannot travel through the tubes to fertilise the egg. Damaged or scarred fallopian tubes can also impact on the process of moving a fertilised egg through the tube towards the uterus at the start of pregnancy. The egg may then attach itself to the fallopian tube, where it begins to grow. This is called an ectopic pregnancy and can be very dangerous. Gonorrhea can also be passed from mother to baby during delivery, causing an infection in the newborn's eyes. Some types of gonorrhea are resistant to antibiotics and can therefore be difficult to treat. If diagnosed and treated for gonorrhea, it is important to have a follow-up visit with a health provider to check that the gonorrhea has been cleared. Gonorrhea and other STIs can be prevented by using condoms and water-based lubricant during sex, having regular sexual health checkups, and ensuring you or your health provider notify sexual partners if you are diagnosed with an STI. Syphilis is a highly infectious, sexually transmissible infection, or STI, that is passed on during intimate skin-to-skin contact or vaginal, anal or oral sex with an infected person. It has several stages and can be infectious over a long time. The first signs of syphilis are often sores or ulcers on or inside the genitals, mouth or throat about 2 to 3 weeks after infection. They can also develop earlier, much later, or don't develop at all. This first stage of infection is called primary syphilis, and the sores, called chancres, can be any size or shape. The ulcers are often painless, don't bleed, and can feel like a hard button on your skin. You may not notice them, especially if they are on anal skin, inside the anus, the cervix, or in the mouth. If there is no treatment, the ulcers usually heal within a few weeks, but the infection does not go away. 2 to 6 months after getting infected, the secondary stage of syphilis occurs. Symptoms may include a flu-like illness, a rash on the torso, palms and soles of the feet, swollen glands, water-like lumps around the moist areas of the body, and hair loss. The rash looks like rough red or brown spots, but these are usually not itchy. Some people also get headaches, tiredness, and pains in the bones, muscles, and joints. You can feel quite unwell during this stage. When the body detects an STI, the immune system tries to destroy the infection. If you do not get treatment, the immune response can cause secondary symptoms, which can come and go for up to a year after the initial infection. Even when these symptoms go away, you are still infectious. Some people will never develop symptoms and will only learn that they have syphilis after having a blood test. After 2 years of infection, you are no longer infectious to other people. This stage of the infection is called late latent syphilis, and treatment at this stage is very important to prevent long-term consequences. For some people, untreated syphilis can turn into tertiary syphilis sometimes up to 20 years after first infected. Tertiary syphilis can cause serious problems with nerves and the large vessels near the heart. Blindness, numbness, and brain damage can also occur. It is very important for all women to be tested for syphilis during pregnancy, as an infected woman can pass syphilis onto her unborn baby through the placenta. This is called congenital syphilis and can be a severe, disabling, and life-threatening infection for babies. The earlier syphilis is treated during the pregnancy, the lower the risk of the baby being affected. Syphilis can also increase the risk of transmission of HIV and other STIs. Syphilis can be easily treated with injections of antibiotics. syphilis and other STIs can be prevented by using condoms and water-based lubricant during sex, using sterile injecting equipment, and having regular sexual health checkups. If you are diagnosed with syphilis, you must ensure that you or your health provider notify your sexual partners so that they can get tested. Herpes simplex virus, or HSV, can manifest in the skin around the mouth or around the genitals. In both cases, herpes can present as a common cold sore or a cluster of small blisters, skin splits, or sores. However, in most cases there are no symptoms at all, and people often do not know they have it. Herpes lives in the skin at the site of infection. It can be transmitted when no symptoms are felt or visible. However, the virus is most contagious when sores are present. Genital herpes is spread with the infected skin on the mouth or genitals coming in contact with the intact skin of the penis, vagina, or anus. Herpes ulcers can form in or on the vagina, anus, penis, or scrotum, which can then cause pain when going to the toilet. In some cases, people can also have flu-like symptoms, tingling, itching, or painful blisters or fever. People who develop genital herpes sores are also at a higher risk of contracting HIV. Herpes cannot be cured, although there are antiviral medications available that can help reduce the severity and duration of symptoms or help prevent the outbreaks of sores. It is very difficult to avoid the herpes virus as it is very common and so many people do not know they have it. You can avoid kissing or sex with someone who has active sores on the mouth, lips, genitals, or anal area. Using condoms can also reduce your likelihood of contracting herpes. However, they do not completely prevent it.
Genital warts are one of the most common types of sexually transmitted infections. Nearly all sexually active people will become infected with at least one type of human papillomavirus, HPV, the virus that causes genital warts, at some point during their lives. Genital warts affect the moist tissues of the genital area. They can look like small, flesh-colored bumps or have a cauliflower-like appearance. In many cases, the warts are too small to be visible. In women, genital warts can grow on the vulva, the walls of the vagina, the area between the external genitals and the anus, the anal canal, and the cervix. Some strains of genital HPV can cause genital warts, while others can cause cancer. Vaccines can help protect against certain strains of genital HPV. The Centers for Disease Control and Prevention, CDC, recommends routine HPV vaccination for girls and boys ages 11 and 12, although it can be given as early as age 9. It's ideal for girls and boys to receive the vaccine before they have sexual contact. Side effects from the vaccines are usually mild and include soreness at the injection site, headaches, a low-grade fever or flu-like symptoms. The CDC now recommends that all 11 and 12-year-olds receive 2 doses of HPV vaccine at least 6 months apart, instead of the previously recommended 3-dose schedule. Younger adolescents ages 9 and 10 and teens ages 13 and 14 also are able to receive vaccination on the updated 2-dose schedule. Research has shown that the 2-dose schedule is effective for children under 15. Teens and young adults who begin the vaccine series later, at ages 15 through 26, should continue to receive 3 doses of the vaccine. The CDC now recommends catch-up HPV vaccinations for all people through age 26 who aren't adequately vaccinated.
Millions of people live with HIV, a disease that weakens the body's defense against ordinary infections.
The body's defense is the immune system, made up of white blood cells, antibodies, and other cells. CD4, a type of white blood cell, fights off invaders.
But HIV attacks CD4 cells. The HIV life cycle begins when HIV attaches itself to the CD4 cell and transfers its proteins and genetic materials into it.
Next, an HIV enzyme called reverse transcriptase converts HIV RNA into HIV DNA, while an integrase enzyme integrates HIV DNA into the host CD4 cell's DNA.
Then, the protease enzyme processes the produced HIV material for assembly into an immature virus.
Finally, mature HIV materials are released into the body, where the cycle starts over again.
There is no cure for HIV, but antiretroviral medication or ARVs reduce HIV reproduction by interrupting the HIV life cycle.
Entry inhibitors prevent HIV material from entering CD4 cells, while reverse transcriptase inhibitors stop the reverse transcriptase enzymes from converting HIV RNA into HIV DNA.
Later, integrase inhibitors block HIV integrase enzyme from integrating HIV DNA into CD4 DNA, while protease inhibitors block the protease enzymes from enabling the production of new HIV material.
By learning more about HIV and ARVs, you are better able to adhere to HIV treatment and protect others from getting infected.